Performing therapeutic bath. Assess the condition of the patient.
So, ma'am, good morning. I am Sarah Charity Damali and I will be your nurse for you. Can you please state your name for me, ma'am?
I am Yasin Janlea Tidoro.
Okay. How about your age, ma'am?
I am 20 years old. Explain the method to the patient or the watcher.
So, ma'am, how are you feeling right now po?
Um, Soon to be okay, I guess.
Okay. So, ma'am, for today, I'm gonna be performing a therapeutic bath on you to aid with your sleep right now. Would that be okay with you, ma'am?
Yes.
Okay.
Wash hands thoroughly before starting the procedure.
So, assuming that I had already performed medical hand washing, I will now be performing hand hygiene.
Close the door or the partition sheets.
So, to provide the client a privacy, I'm gonna close the partition sheet.
Adjust the patient's bed on a certain height that is accessible for working.
Okay, so now I'm gonna have to adjust the patient's bed on a accessible height for me to begin with the procedure. So just gonna adjust it here. Okay now.
Place the bed protector or rubber sheet on patient's bed.
Okay, so as you can see, there's already a rubber sheet on the patient's bed.
Put your working gloves on.
So now let's assume that I had my gloves on.
Immerse the face towel in the water until saturated.
Okay, so we're just gonna put the face towel in this bowl until it's saturated.
Bring all equipment and set them on the area near the bed.
Okay, so as you can see, I've already prepared all the equipment that I'll be needing with the procedure.
Drape the patient properly and expose only the body part to be sponged.
Okay, so I'm gonna drape the patient properly to avoid shivering. Okay po.
Carefully remove patient's clothing and place the bath blanket on top of him.
Okay, so now ma'am, I'm gonna have to remove your gloves, okay? Okay, so I'm just gonna put this in here.
Wring out the face towel before sponging the patient.
Okay, so I'm just gonna squeeze this towel or wring it out before sponging the patient. Okay.
Place cool, moist washcloth in axilla and groin. Remove when it starts to dry.
So I'm just gonna wet this one. So mom, I'm just gonna put this in your axilla, okay? So I'm just gonna expose this area now. Now we have one. Now let's expose the farther leg of the patient. Okay. Now the other one. Okay.
Make a knit with a sponge towel.
So I just gonna put this one here on her forehead. So I'm just gonna wet this towel and make a mitt with it. Okay.
Pat patient's face gently with a face towel. Sponge patient's face down to the extremities. Pat each extremity separately. Pat each area to dry after sponging and avoid rubbing with the towel.
Okay, so mom, I'm just gonna pat your face, okay? So now I'm gonna pat it dry using this towel. Okay, so now I'm gonna have to pat it dry now. Okay. So now the other one. And pat it dry. And now let's expose the farther leg of the patient. Okay. And pat it dry also. So always remember to avoid rubbing the patient's legs or her arms. Now let's expose the area here and pat it dry. So now I'm just gonna pat it dry. Okay. And close or break the patient again.
Place the towel across the patient's chest and fold down to the midline of the patient's abdomen.
Okay, so now we're gonna have to expose the patient's chest and pat it and pat it dry. Now her abdomen. And pat it dry.
Expose the further leg by folding the blanket diagonally and placing the towel underneath. Sponge leg in a patting motion and then pat dry. Do the same on the other leg.
Okay. So now we're gonna have to sponge the client's farther leg. Okay. So I'm just gonna expose it diagonally. Okay, now. And pat it dry. Okay. So I'm just gonna cover it up. Now expose the other side of the leg. And pat it or sponge it using this towel. Okay, so now. Okay. So now we're just gonna pat it dry. Okay. And cover it again.
Turn the patient to the side and sponge his lower back and buttocks for 5 to 10 minutes.
So before that, I'm gonna have to remove the towels that I have put on her forehead, axilla, and groin, because as of now, it already dried. So I'm just gonna remove this one now. Axilla. Mhm. And on your farther leg, cover your again. Okay. So, ma'am, I'm gonna have you to turn to the other side of the bed, okay? So, yeah. So always remember to keep the drape So now we're gonna have to wipe the client's back and buttocks for about 5 to 10 minutes. So using this moist towel, I'm gonna make a mitt with it. Okay. And pat the client's back and her buttocks. So now,
Put on a clean, fresh, laundered hospital gown and cover clean marker lightly.
so now I'm gonna have to pat the back of the client to dry. And of course, her buttocks. Okay, so now ma'am, you can now lay flatly on the bed. Okay. So now I'm gonna have to put on the client in a clean laundered patient's gown. So let's assume that this one is a patient gown, okay? So ma'am, I'm gonna have to expose your arm. Okay. Now the other one now. Now put on the patient's blanket. Okay.
Document the date, time, and the duration of the bath and the patient's response to the procedure.
So after that, we must document the date, time, and the duration of the procedure and the patient response to the said procedure. So with further ado, let's move on to the next procedure or the return demonstration video. Thank you. Good day, I am Sarijari Didamalo, and for today's return demonstration video, I'm gonna be performing therapeutic bath. So with further ado, let's begin with the procedure. And thank you.
I mean,
Good afternoon, ma'am.
return.
I am Sarijari Didamalo, and I will be your nurse for today. So ma'am, can you please state your name for me?
I am Miss St. John Lea Victoria.
Okay, how about your age, ma'am?
I'm 20.
Okay. So how are you feeling right now, ma'am?
Not that okay.
Okay. So I presume that you need a therapeutic bath. So ma'am, for today, I'm gonna be conducting a therapeutic bath on you. Would that be okay with you, ma'am?
Yes.
Okay. So, assuming that I have already performed medical hand washing, I will now be performing hand hygiene. So, using this alcohol, let's proceed with the hand hygiene. So, to provide patient privacy, I must now close the door or the partition sheet. And of course, as you can see, I've already prepared the rubber sheet here and adjust the bed to an appropriate height or an appropriate working space. So mom, I'm just gonna adjust the bed, okay? Okay. So now I'm gonna have to wear my surgical gloves. So I'm just gonna open it up. So now I'm gonna immerse the paste towel on the bowl. Okay. And bring all the equipments that I'll be needing for the procedure near the bedside. So as you can see, here are the things that I'll be needing for the procedure. So I'm just gonna dispose this one. Okay. So now I'm gonna have to drape the patient using this bath blanket. Okay. So now I'm gonna have to remove the patient's clothes. Okay. So ma'am, I'm just gonna remove your clothes. Okay. Okay. Now the other one. Okay. So now I'm just gonna cover the patient's exposed area again. Okay. So I'm just gonna put her clothes over here. So now I'm just gonna wring out all the towels here in this bowl to remove excess water. Okay. So now I'm just gonna wring out this one again and place it on the client's forehead. Okay. And now on her axilla. So first I'll have to begin on the farther side, the patient's axilla. Now in here. So I'm just gonna cover the client's exposed area. And now I'm gonna place this on her farther leg or on her farther groin. Now I'm gonna expose the other area of the groin and place the towel in here and leave it until it dries. So now I'm gonna have to make a mitt using this towel, but before that I'm gonna have to moisten it and wring it in here. Okay. So I'm just gonna make a mitt in here. Okay. And prepare this towel in here for pat drying the patient. So first I'm gonna pat the patient's face. Okay. And now I'm gonna pat it dry. So now let's expose the client's farther arm and pat it using this wet sponge towel. Now I'm gonna have to pat it dry. Always remember to avoid rubbing. Now cover the patient's exposed area. Now the other side again. So I'm just gonna make a mitt in here. And then pat it using this wet towel. Now let's pat it dry. And cover the exposed area. Now let's expose the client's chest and pat it using this wet sponge towel again. So I'm just gonna make a mitt in here. And then pat the client's chest. And then pat it dry. Now her abdomen. Okay, mom, I'm just gonna expose your abdomen, okay? So, just gonna make a mitt again. Okay. And pat the client's abdomen using this wet sponge towel. Then now let's pat it dry. Okay. Now cover the exposed area of the patient's abdomen. Okay. So now we're gonna have to sponge the client's farther leg. So now I'm just gonna make a mitt using this towel. Okay. Now let's expose the set area. So ma'am, I'm gonna pat wet your farther leg. Okay, diagonally. Okay. Now I will dry it by patting it dry using this dry towel I have here. Okay na? Okay. Now cover the exposed area. And now the other side of her legs, the one that is closer to me. So I'm just gonna pat it using this wet towel. Now, I'm gonna have to pat it dry. Okay na. Now I'm gonna cover it again. So now I'm gonna have to remove all the face towel that I have put on her forehead, axilla, and groin, because as of now, it has already dried. So I'm just gonna remove this one, ma'am. Okay. The other one, ma'am. Okay. I'm just gonna cover you up. Now on your farther leg. Okay, ma'am. Now the one that is closer to you. So now, ma'am, I'm gonna have you to move to the other side of the bed, okay? So that I can wet your back and your buttocks, okay? So, ma'am, I'm just gonna have your hand here, okay? So, okay. So now I'm gonna have to expose the client's back and buttocks. So, I'm just gonna have to wet the towel in here and wring it up and make a knit with it. So now I'm just gonna have to pat wet the client's back and now her buttocks. And now I'm gonna have to pat it dry using this dry face towel I have here. Okay. So now, ma'am, I'm just gonna pat it dry, okay? By patting the client's back and buttocks, it should be of a duration of about 5 to 10 minutes. So I'm just gonna cover the patient up again. So now, ma'am, you can lay to your position back again. Okay. So now I'm gonna have to put on the patient's gown. Okay. So I'm just gonna go and get it here. Okay. So now, I'm just gonna expose your arms so that I can put on your patient's gown. Okay. So now, you put your arms here. Okay. So I'm just gonna cover up the client again. Okay. So after that, we are done with the procedure. So now I'm gonna have to document the date, time, and the duration of the procedure and the patient's response to the said procedure. So that would be all for the therapeutic pack. Thank you.